Mentioned to you the long COVID problem. I did have COVID once, briefly, but I've been vaccinated, I think, 5 times. So I guess it wasn't going to be serious, but my heart goes out to those people who not only had it, COVID, badly, but it stayed with them, long COVID, which, according to the World Health Organization, is a major problem for between 10 and 20% of people who suffer from it. On the line, I've got Quentin Grafton from the School of Public Policy, Australian National University. Professor, thank you for joining us.
Oh, you're more than welcome, and welcome. Thank you for the opportunity to speak to your listeners.
Well, it's what do you know about long COVID? You're not suspicious of it being something that is more psychosomatic than real, are you?
Oh, I wish it were, but no, not at all. There's a huge amount of studies, hundreds, if not thousands, of peer-reviewed pieces of work that have come out in top journals with a bunch of researchers all over the world. So long COVID is a catch-all term for a series of symptoms. I think there's 26 that have sort of been listed. And some of them may appear to be quite minor, like loss of sense of smell. That's actually a very common symptom. But some are much more severe, like a post-viral syndrome, which is like a chronic fatigue, which in some cases means that people can't even work. They can't even get out of their house pretty much. So from one extreme to the other, so to speak, that's long COVID. And typically, again, it depends how you define it, but typically these are symptoms that last more than 3 months from your COVID infection. Some people, fortunately, it's a small proportion, but some people have those symptoms going on more than 12 months. And so, yes, you highlighted, of course, that, 10 to 20%, those are the sorts of numbers. It's really quite uncertain about it, who have one symptom or more. But on the other hand, it's worth highlighting that although that's a smaller proportion, there's a 3% perhaps would be having long COVID with severe enough symptoms that impinge on their daily life, or means that they can't work the hours that they used to, or in some cases can't even work at all.
Do you have any idea why it affects some people and other people just get over COVID and move on?
No, there's some hypotheses around it. There are associations. So being a woman increases your risk. Age increases your risk. There are other factors as well, but there are clearly risk factors there. You highlighted at the beginning about vaccination. Not being vaccinated also substantially increases your risk of long COVID. So keeping yourself up to date with your vaccinations is clearly a good thing to do, and it does reduce your chances of getting long COVID. So, yeah, there are several risk factors out there. Some of them we can't do much about. We can't change our gender and we can't change our age, but we can certainly get vaccinated and get boosters to reduce the chances of getting long COVID. It reduces, it doesn't eliminate it.
I keep running into people who say, yes, it's all about the vaccine. This is the real problem. The vaccine causes the long COVID. It's nothing to do with COVID. It's the result of being vaccinated. How do you argue against that? What do you say about that?
Well, it's not true. Again, there's a huge amount of evidence to back up what I've just said, so you don't have to take my opinion for it. Yeah. But just think of Australia, so we didn't get vaccines here until 2021. All right, so most people didn't get vaccinated until, it's in the second half, basically, of 2021. So there were people who have come down with long COVID who didn't get vaccinated. I mean, essentially, no Australians got vaccinated in 2020. Okay, yeah. Yet there are a bunch of Australians who got long COVID in 2020. There's a bunch of Australians who got long COVID in 2021 who hadn't been vaccinated yet. So Australia is a useful test case, but there are other cases as well. There are a bunch of people who didn't get vaccinated and got long COVID, and there's a bunch of people who did get vaccinated who got long COVID. But the proportion of getting long COVID is less with those people who have been vaccinated. And again, those are studies that involving lots of people. So as I said, you can take my word for it, or you can look at the literature. But it's not nothing to do with vaccinations. Vaccinations are not causing long COVID. COVID is causing long COVID.
Yep.
That's what's so the best way to not get long COVID is not to get COVID.
Yes. Do you have a personal idea as to where it came from?
Look, yes, I do, but I don't want to go down that path. I don't want to cause controversy. But yes,
I love controversy.
No, it's very clear. It came out of Wuhan, and that's where it came from, and it obviously has went from there.
Could it be man-made?
There is this notion, they call it gain of function.
Yeah.
And so the virus would have originally have come from another source. Obviously, it's existing in the animal kingdom, and then they do various things in laboratories. They call them gain of function, and that seems likely where that SARS-CoV-2 virus came from. It likely came of a gain of function. But again, I don't want to go into details. There's a lot of speculation around that and controversy. And my point is not that where it came from. It did come from someplace, and it does cause, and it is continuing to cause a lot of grief for people, and we just have to respond to it.
We have the antivirals, which I got onto as soon as I tested positive, and I think that probably led to the fact that it didn't stay with me for very long.
Yes.
But how do you, when somebody's in the grip of long COVID and maybe they've had it for a year or something, how do you treat it?
Well, you have to go to speak to a medical professionals. There are various things depending on the person concerned and what treatment they've already had ahead of time. So yeah, there are clinics in the big cities in Australia. So if you have long COVID and have had it for a considerable period of time, and you're not attending one of those clinics, then make sure you see your GP and get attention there. So I don't want to say what treatment is required or not. That's not I'm not qualified to do that.
No, I don't know how they could calculate it, but I've seen that long COVID costs the community up to $10 billion, or in fact, it did cost $10 billion in 2022.
That's right. That was our work that came out on Monday in the Medical Journal of Australia, and it was a group effort. There's, I think, 6 or 7 of us. So people in public health and epidemiology and economists. I'm an economist working in the area of COVID. So yeah, what we did is obviously there's a range here. One number, you don't hold yourself to one number, but there's a range, and you have a 95% confidence interval around these low and upper numbers, and the 10 billion is about the middle number. And what it is that when people have long COVID of a sufficiently severe severity, not everyone who gets long COVID can't work, but there's a certain proportion who can't work or underemployed in the sense they can only work fewer hours. Those sorts of people drop out of the workforce, and that's what happened in 2022. And that reduced the employment hours by about 100 million hours, and that 100 million hours translates into about $10 billion. So it's a big number. I mean, our economy is $2 trillion, okay, but it's still a big number, because if you took every Australian and divided the 10 billion by the number of Australians, it works out to a little less than $400. So that per person. So it's big. It needs to be responded to. And we need to have policies in place that reduce the impacts of long COVID. And there are clear policies in place to increase the eligibility of vaccinations for boosters. So at the moment, a certain age, elderly and vulnerable can get it every 6 months. Other Australians, it's every 12 months. Access to antivirals, you mentioned you have them. That's great, but most Australians don't have access to antivirals or cannot get access to antivirals. So that those two things could help. And of course, the most important thing would be to reduce the level of infection of COVID, because you can't get long COVID unless you get COVID. So there's things to be done in terms of indoor air quality. And I think that's a very helpful initiative. And then just masking in healthcare facilities, hospitals, medical facilities. I mean, that's because that's where people are vulnerable and get sick.
Yes.
And go there when they're sick. So just have some precautions in those locations, and that I think would help. I mean, it's not going to bring COVID to zero, so there will always be infections, pretty much. But what it does do is reduce the level of infections. If that reduces the level of infections, then it reduces the number of people getting long COVID. So those are, in my view, sensible precautions. They make sense from benefit and cost. We should do them. It's as simple as that.
From maybe overreacting in the beginning, I see around me a remarkably casual attitude to COVID now. Nobody seems to be too concerned about it. No more serious than the flu, they say.
Yeah, look. I think it's worth highlighting this, that for most people, yes, it's not a big deal. They may be sick for a few days, or some cases, a couple of weeks. But the point about it is that a lot of people have got, just about everybody's got COVID or had COVID in Australia. And so even though the proportion of people who end up with severe symptoms with long COVID is small, nevertheless, if most of the population are getting COVID, you're still getting a lot of people. So, we're calculating, depending on the assumptions we want to make, and, again, it's a range, 170,000 people have long COVID in Australia. Could be 300,000, but that's because most Australians have had COVID. Okay, so most were covered, and that's fine. But the small proportion of a big number is a big number. So that's essentially where it is. And most people, when they think about COVID, they think of 2020. Of course, it was bad in all sorts of dimensions, economy, health, etc. But the point about it is, it's not a 2020, it's 2024. So it's not an issue about people dying. People are dying of COVID, but it's much, much smaller proportion than it was because of vaccinations and, of course, hospitalizations. But the fact is, the proportion of getting long COVID is much, much higher than the people ending up in hospital or dying from COVID. Much, much higher. And more importantly, for the working age population, it's not just the elderly and the vulnerable. The largest number of people with long COVID are, in fact, at the working age, between 30 and 59. That's the biggest number of people with long COVID. So if you feel like you're not going to end up in hospital and you haven't been hospitalized, you didn't have severe symptoms, that's fine and that's great. But there are a lot of people who have had mild symptoms who ended up with long COVID. In fact, most people who ended up with long COVID have, in fact, had mild symptoms in the sense that they didn't end up in hospital.
Right, and the symptoms are basically like chronic fatigue syndrome or brain fog, just a feeling of malaise.
A whole series of them, and some that so some of those are patient identified. Yeah, brain fog, fatigue. Obviously, you know that, and some of them are symptoms that you wouldn't even know about. So unless you had a series of medical tests, all right, that things are going on. So that those would be also symptoms of long COVID.
But the experience is that people do get over it.
Yes. So it is worth highlighting to your listeners that a good proportion do recover. So those people with long COVID, they still have symptoms after 12 weeks. They do slowly get better. Most people slowly get better. There are a certain proportion, however, who had long COVID for more than 12 months, and that's obviously a very difficult situation for them, especially if those symptoms are severe. That's a very, very difficult situation for them, their family and friends. And clearly, if it's of a severe form, such as chronic fatigue, it's very difficult to be employed and actually keep down a job. So it's a tragic situation for them.
Yeah. The public policy will be that I guess we have go on having boosters every 6 months or so.
Well, that's what we would be saying from our analyses in long COVID. So rather than every 12 months, we think it should be available every 6 months because of the fact that it appears that boosters do reduce the chances of long COVID. So, obviously it's voluntary. No one should be obliged to get a booster. But the point is, if you wanted one every 6 months, it seems very sensible that you should get one. The cost of a vaccination is trivial relative to the cost of people getting long COVID. So that would make sense.
I've sort of lost track. I think I've probably had 5. I don't know.
That would be right. I would think that would be around 5. Some people would have more because they are vulnerable. They may have ability to have more. But yes, that would be, I think that's about right, yes.
And I'm intrigued by the bird.
Yes, it's a magpie on that side. My apologies.
No. It's a wonderful sound.
Yes,
it's a wonderful, cheery sound.
Yeah, I like magpies, yeah.
Professor, thank you very much for your time. I'm very grateful.
Okay, thank you. Thank you for the opportunity. Okay, all the best.
Your time
Bye-bye.
and knowledge. Professor Quentin Grafton from the School of Public Policy at the Australian National